If you've been referred by your doctor to have a colposcopy, you'll get a call to make an appointment. It's best to find and treat abnormal cells as soon as possible, so it's important not to miss any appointments. If you can't make your appointment, don't cancel. Call the clinic right away to book a new date and time. A colposcopy can cause mild bleeding, so talk to your healthcare provider if you're on aspirin or other blood thinners. You may be asked to pause these types of medicines before your appointment. Also, let the clinic know if you're pregnant or are planning to become pregnant. Come prepared for your appointment. Bring picture ID and your Alberta healthcare card. Plan to spend at least 1 hour at the clinic. Wear underwear and bring a pad with you. After you check in at the front desk, use the bathroom to empty your bladder. Come to your appointment prepared to provide the following information: your contact details, the date of your last menstrual period, or, if there is a chance you're pregnant, how many pregnancies and deliveries you've had, if any, the type of birth control you're on, if any, the year you had the HPV vaccine if you've had it, and whether you've had a colposcopy or treatment for an abnormal Pap test before. You might also be asked if you're in menopause or whether you've had a hysterectomy, which is a surgery to remove the uterus and cervix. If you've had this surgery, you can still have abnormal changes to cells in your vagina. When you're brought to the exam room, you'll be asked to undress from the waist down and will be given a sheet to wrap around your waist.
Hi, I'm Dr. Smith. I'm one of the colposcopists here.
You'll lie down on your back on the exam table. Your feet may be placed onto footrests for support. You can request that a nurse is present during the exam if you're uncomfortable. Your doctor will insert a lubricated tool called a speculum into your vagina. This will gently open your vaginal walls so the doctor can see inside. A mild vinegar solution, iodine, or both, will be applied, as these cause abnormal cells to change color, so they're easier to see. You might feel a mild tingling. Your doctor will use a high-powered microscope, called a colposcope, to look closely for any abnormal cells on your vulva, vagina, or cervix. The microscope is not inserted into your vagina and will not touch you. It uses magnification to see cells more clearly. Your doctor may do a biopsy. A biopsy is when a tool is used to take a tissue sample about the size of a grain of rice. You may feel a pinch, a scraping feeling, or some cramping. Your doctor may apply a medicine to the areas where tissue was taken to stop any bleeding. Tissue samples are then sent to the lab for testing. This will indicate if you have any cell changes and can help determine the best next steps. After your colposcopy is finished, the clinic will provide you with further instructions. It can take some time for the lab to examine the tissue samples and for final results to be ready. After the test, you may have a bit of vaginal discharge, like at the end of a period. It can be clear, black, brown, or bloody. All of this is normal. That's why it's best to come to your appointment wearing underwear and to bring a pad. Any light bleeding or discharge should stop within 1 to 2 days, but can last as long as a couple of weeks. After your appointment is done, it's okay to return to your normal activities, except heavy exercise. It's recommended that you take it easy. Light stretching and walking are okay. You may return to regular exercise the following day, as long as you're having no discomfort. If you feel any mild pain or cramping, you can hold a warm water bottle against your stomach or back, or use over-the-counter pain relievers. To allow your cervix to heal, avoid sexual activity, using vaginal or cervical medicines, or douching for 2 days. Seek medical attention right away if you experience heavy vaginal bleeding that soaks through 1 pad per hour, severe belly pain, bad-smelling vaginal discharge, fever, or chills. For more information, visit screeningforlife.ca, watch the other videos in this series, or talk to your healthcare provider.